STDs, or sexually transmitted diseases, are very serious health conditions. And actually, the incidence of a number of sexually transmitted diseases is increasing in Pennsylvania. And that includes the incidence of chlamydia, gonorrhea, and a very serious condition called syphilis. And so as an adolescent medicine specialist, I know how important it is for young people to protect themselves from these infections. And so, of course, having someone's parents or guardian talk to young people about their sexual activity and about how to protect themselves from sexually transmitted diseases is very important. What people don't really realize about sexually transmitted infections is that the majority of the cases are in patients 15 to 24. And so that's why my experience as an adolescent medicine physician treating patients at those ages, adolescents and young adults, really has been invaluable in terms of my knowledge about this issue. And so it's really important that young people get vaccines, such as the human papillomavirus vaccine. It's really important that families talk to their teenagers about sex and sexual activity. We always recommend that young people abstain from sex, but if they're going to be sexually active, that they use safe sex measures, such as condoms and dental dams. And that can protect against the sexually transmitted infections that we've been talking about, chlamydia, gonorrhea, syphilis. It also can protect against HIV. Now, HIV, or human immunodeficiency virus, the rate of that has been decreasing, but it's so important for people to protect themselves either by abstaining from sex or by using those safe sex measures. Vaccinations are so important. Immunizations are a very important aspect of public health, and we have prevented so many serious infections with immunizations. And those include immunizations against hepatitis B and immunizations against what is called the human papillomavirus, or HPV, and those can be sexually transmitted infections. Now, most people actually get the hepatitis B immunization at birth now, although it's very important for people to check with their doctor whether they have received that vaccine and they are protected. In addition, most young people are eligible to get the HPV, or human papillomavirus vaccine now in early adolescence. It's recommended for 11 and 12-year-olds, boys and girls. And so we strongly recommend that vaccine. That vaccine can protect young people against conditions such as cervical cancer and penile cancer and oral cancers. So we don't really think of it as a sexually transmitted infection vaccine. We think of it as an anti-cancer vaccine. So syphilis is a very serious bacterial sexually transmitted infection, and it can cause significant problems for the person themselves who are infected, but also can be transmitted from mother to baby. And so we really recommend that actually obstetricians or family medicine physicians test pregnant patients for syphilis. Syphilis is very treatable with antibiotics. So we want families to talk with their young people about sex and about sexual activity. So of course, abstinence is best. And so if a young person is not sexually active, then that would of course protect them. We also want young people to know about safe sex, and that includes using condoms or dental dams if they are going to engage in sexual activity. And so those type of protective measures are very important. It's important for parents to discuss them.